Good morning, everyone. Thank you for joining us. This morning we are joined by Provincial Health Officer Dr. Bonnie Henry in Victoria and Minister of Health, Minister Adrian Dix in Vancouver. As a reminder to media on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up only. I will now hand it over to Minister Dix. Please go ahead, Minister.
Thank you very much, Lindsay. I'm honored to be here in Vancouver on the territories of the Squamish, the Musqueam, and the Tsleil-Waututh First Nations. Dr. Henry, of course, in Victoria, on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. We're both honored to be here. Coming week that on December 27th and December 28th, we will be providing in the afternoon written daily numbers on vaccinations, case counts, and preliminary case numbers. Regular reporting will be back on Wednesday, December 29th, along with a media availability in the afternoon on December 29th. So we're going to continue to provide our preliminary case counts, and those will be confirmed in the numbers provided on Wednesday, December the 29th. And with that, it's my honor to introduce Dr. Bonnie Henry. 29th. And with that,
thank you very much,
Bonnie Henry.
Thank you very much, and good morning. As many people are beginning their holiday celebrations, I felt it important to update what we know right now about what is happening with Omicron and how it is spreading in British Columbia, and to provide some guidance on what to do if you are developing symptoms or have developed symptoms of COVID-19, and of course to talk about when one needs to get tested. What we are seeing across this country and across the globe is that Omicron is different. It is spreading in a way that is very different from previous variants. In a sense, we're in a different game, a different pandemic now. Some parts of it we know more about. We're putting that puzzle together globally. We know more about the infectiousness of Omicron right now, and it is more highly infectious than any of the other strains of this virus that we've seen. We know more about breakthrough infections and about reinfections. And there's data that's showing up from around the world that tells us that we can get more breakthrough infections in people who have been fully vaccinated, but they tend to be less severe. Those are things that we're still watching. We also know that people who have had previous infections are much more likely to get reinfected with Omicron. So those are important things to remember. We still do not have a full picture about how severe Omicron can be across the board. And that is something that we need to continue to monitor and watch. And that's why we're talking today about the things that we need to do until we understand that in the coming weeks. Earlier this week, I mentioned that all of us would likely be exposed to this virus, to Omicron, knowing the way it was spreading in our communities. But this does not mean that all of us will get sick or will get severely sick. It's an entirely new game, as I said. What we are seeing is that Omicron is more likely to attach to the upper airways, to those ACE2 receptors in our upper airways, which means it can spread with very small amounts of the virus. It replicates quickly, and it means that those smaller particles or aerosols are much more important, and it can spread more easily, especially during activities like singing or talking closely to each other indoors where ventilation is poor or breathing hard. So people are getting infected with a much smaller amount of the virus and more quickly, and they're passing it on to others. And with this Omicron variant, what we're seeing is these pieces of the puzzle are coming together, is that the incubation period, or the time between exposure and getting sick yourself and being able to pass it on to the others, to someone else, is very small. What we were usually seeing in 5 to 7 days on average is now down to around 2 to 3 days. So you can pass it on to others even before you realize that you're positive for the virus. We also know that Omicron is spreading faster in people who are not yet vaccinated. We know that because we see that transmission being explosive in some of those settings. And it's because our immune system has not developed those defenses that are very specific for this virus, for the spike protein that vaccination gives. This means that if you are at all sick right now, even if you think it isn't COVID, even if you think it's just a mild cold or a flu, you need to take precautions and stay away from others, particularly people who may be at risk because their immune systems aren't working so well, because they have not been vaccinated, or because they're older or younger. Even now, especially if anyone in your family is at risk, you need to stay away, even if you don't think it is. It's COVID. The speed of transmission at this point also means that our case and contact tracing cannot keep up. We can keep up with people who have a test, and we'll talk a bit more about testing, but we cannot find contacts, and people know this, within 2 to 3 days. It often takes a little bit longer. So it's really important right now that all of us pay attention to this. This virus is spreading. It's spreading in all of us. And we need to take those actions, and we can take those actions, which keep ourselves, which make a difference to control the impact the virus is going to have both on ourselves and on those we are closest to, that we are more likely to spread it to. This means we need your help to make sure that you are taking the actions you need to do and notifying people around you if you are positive for COVID-19. In addition, our testing centres are at their maximum capacity. We did over 20,000 PCR tests yesterday, and that's the maximum that we can do. So I want to be very clear. Do not go to a testing centre unless you have symptoms. And then we need to preserve the more accurate PCR testing for those who really need it. The testing centres are not for pre-travel screening, nor do they give you a green light to spend time with others. We've talked about this before, but this is more important than ever. A negative test is not a green light. All of our testing is for people who have symptoms, or for people who need to rule out, and for people who need to rule out that it is COVID. So this is important right now more than anything. The testing centres are to confirm that someone with symptoms of the virus has COVID-19, or to rule it out for those key workers like healthcare workers or emergency responders who need to be able to go into work. I encourage everybody to go to the BC CDC Symptom Checker online. It's a good tool to use to help you understand if you need to get a test. Right now, our PCR tests need to be used for those who are at highest risk. So that means people who are older, over age 65, people who have underlying illnesses, and people with more severe symptoms where this makes a difference in how they get treated and access to treatment. So that is the first priority at our treatment centres, and as well to test people with symptoms who are hospital workers, emergency responders, and others who need this. Rapid testing is also now being used to supplement our PCR testing at many of our testing centres. It's also being used in a number of different settings like remote communities to really determine if COVID has made it to those communities. Rapid testing will be used again for people with symptoms to help you understand what you need to do. It will be mostly targeted to people who are younger with milder symptoms without risk factors for more severe disease. Given the rate of transmission that we are seeing, if you have any symptoms of COVID-19, Omicron is different now. If you have any symptoms, you must assume you have COVID and take measures to avoid passing it on. If you are younger, and vaccinated and no other risk factors, you don't necessarily need a test. You just need to take these actions now. If you are fully vaccinated and have mild symptoms, you should assume you are positive, stay home and stay away from others for 7 days. If you are not fully vaccinated and don't have other underlying risk factors, you must isolate for 10 days. And this is because we know that vaccination helps us manage these infections more rapidly, so we shed less virus for a shorter period of time. You should as well notify your close contacts, and that's people that you've spent time with, particularly indoors in close proximity without wearing masks, and they need to monitor for 14 days to check for symptoms themselves. Anybody who is unvaccinated, who you've had close contact with, if you have symptoms and positive for COVID, needs to stay away from others and monitor and self-isolate for 10 days. This means, regrettably, that we will need to adjust our holiday plans if we have symptoms right now that could be related to Omicron. You need to isolate yourself from those people in your household, particularly anybody who's at risk and anyone coming to your home. We all need to gather together now and continue to support each other, to support people who have symptoms, who are doing their part to keep us all safe. Things like bring your turkey dinner delivered to you instead. Your close contacts and anyone you live with should limit their interactions with others and closely monitor themselves for symptoms as well. Anyone with someone in their social network who recently tested positive or who is awaiting test results or is at home with symptoms, you should consider yourself a contact of Omicron. Don't go to group gatherings, and particularly don't go to gatherings where you'll be with people who have risk factors for severe illness. If you do have symptoms and they worsen, or you're having difficulty breathing, chest pain, can't drink anything, and your self-care is not helping you manage your illness, then do not be afraid to call 911 if you need it, to call 811 to get advice, or talk to your healthcare provider. While I caution about the need to get tested, if you are seriously unwell, please do not hesitate to seek care immediately. One by one, this piece of the puzzle that we didn't know yet, and the one piece of the puzzle that we are still working on, is how severe illness Omicron will cause. We're watching very carefully hospitalizations and ICU cases in this province and around the world, and we've had some positive results on that side, some positive tests coming in, positive studies coming in the last few days. Particularly, some hope that we see from what's come out of Scotland, from the UK, and from South Africa, which seems to indicate that in many cases this is a milder illness in most people. So that is hopeful news. We don't yet know that for our context here in BC, but I also am very hopeful. We have a lot of people who have stepped up and gotten the protection that vaccination offers, that have gotten their booster doses, and we have been good at taking these measures to protect each other. We will continue to be watching these measures, the data that's coming from around the world very closely. There's still some caveats that we don't yet know. Particularly, we think about the study in Scotland which showed a much reduced risk of hospitalization. That was still in people who are younger. And we know that younger people have a lower risk of hospitalization anyway. As we're starting, as this Omicron is progressing and moving into older populations, we need to know if that still holds. So there's still a period of time of uncertainty right now. So this is a different virus, this Omicron, that is now causing what we are seeing across our province. And once again, a different holiday season for all of us. For many, including me, physical activity, going to a gym or a fitness center, is a key part of mental and physical well-being. And I know that this has impacted people, that we've required these to be closed on a temporary basis right now. This is a very high-risk period. We see this is transmitting rapidly, and particularly in young people, and when we're doing those types of activities where aerosols can be generated. I know that all those in the gym community have been doing their part, and gyms and fitness centers have had really good protocols in place, and people have stepped up and gotten vaccinated to protect each other. And this part, I now need you to continue to have that contact and connect with those people in your community. Do things online. Go outside and meet for a walk or a run if you can. Connect and support each other virtually right now to slow down the spread, but keep that ever important connection that you get through your community, whether it's your church community, your gym community, or the people that you're closest to. I would like to assure you as well that the uncertainty around this virus remains high, but we will be back to doing those activities in gyms, in fitness centers, in all of those other places, as soon as we know more. And while we need to keep our groups small right now, limit our in-person connections, let's ensure we are maintaining those important social connections in a safe way, like we did last year, like we have learned to do. It is so, so important to connect with each other, especially this time of year. And I encourage you to resurrect all those things that we were doing before. Now's the time to bring them back out again, whether that's reaching out to people who may be alone, sending them a text or a note or calling somebody, deliver a meal or baking to someone who may be isolating. Continuing to connect virtually is so important. We know it's not the same, but it will get us through this next few weeks. We need to give each other a booster shot of communal kindness right now. It is incredibly important and safe connection. And I ask you, let's continue to do this together. We will get through this wave, this new challenge that we are faced with, and we'll get it through together by being kind, being calm, and being safe. Thank you.
I will now hand it over to Minister Dix. Go ahead, Minister.
First of all, I want to start by expressing my gratitude, I think everyone's gratitude, to people working in healthcare around BC who are doing exceptional things right now to support people in very challenging, very difficult times, those that have been described by Dr. Henry just now. Dr. Henry mentioned that yesterday we processed 20,133 PCR tests for COVID-19, 20,133 with a 24-hour turnaround. And what that reflects is exceptional work by workers at our test sites, but also in our labs who, at this challenging time on December 22nd and 23rd, did that extraordinary work, but that reflects the work done in our hospitals and in the community and long-term care by our ambulance paramedics, by all those at our immunization sites who are going, to say the least, above and beyond. And I want to wish all of them, express to all of them my gratitude, my personal gratitude, and I think those of everyone in BC for their efforts. Omicron, as Dr. Henry has said, takes every opportunity. We give it to spread. And it's up to us, all of us, in all of our different ways, to slow that spread. It's up to us to keep our emergency rooms and hospitals from being overwhelmed. We need to adhere to public health orders. We need to follow the latest public health guidance. We need to use our COVID sense. And right now, we need to make sure that COVID test sites are there for the people who need them most. If we're symptom-free, we do not go to get a test. If we have mild symptoms, we act like we've been exposed and stay home, because that helps stop the spread. If we have severe symptoms, our healthcare workers and our healthcare system are here for us, and we go and get medical help. Regarding booster shots, just a brief update. Our rollout continues to be robust. 807,094 third doses or booster doses have been provided in BC. In addition, 120,844 children from ages 5 to 11 have received their first doses of the Pfizer vaccine designed specifically for them. Yesterday, for example, there were 38,500 total bookings. 34,000 of these were booster or third doses. Our original plan projected 32,000 doses at this time of the year to be administered weekly. Then it was raised to 99,500 when we opened additional clinics, and we have done 106,000 from Monday, December 20 to last night. We still have unbooked capacity, and are urging people to book when they receive their invitation. As of yesterday, spots that are not booked include this week 7,000 and next week 25,000, of which 14,000 are in the interior. In the first 3 weeks of January, 203,000 are not yet booked, with more appointments going up every day. Currently, we have a total of 656 locations for vaccination around the province through to January 2nd, including health authority clinics and pharmacies. There are 80 clinics offering vaccinations to children 5 to 11 around the province across these 2 holiday weeks, so we can add to the 120,844 children who are vaccinated against COVID-19 and receive their first dose vaccination from ages 5 to 11. A total of 147,371 vaccinations are projected for December 22nd to January 2nd, and this does not include our drop-in sites. We're making progress, with 20% of the eligible population already having received their 3rd dose. 75% of those 70 and older who are eligible have received a 3rd dose or booster dose, and that includes many other groups, and this is specific to our effort to target booster doses at those who are at the greatest risk. So our clinically vulnerable in categories 1 and 2 have been 135,253. Of those groups have been vaccinated. As of December 10th, we started sending on our 6-month after 2nd dose system to the 3rd group of clinically vulnerable people. And of course, tens of thousands of healthcare workers, more than 30,000 people who are double AstraZeneca or Covishield in their 1st and 2nd doses, well over 50,000 Indigenous people, and so on. Our program continues to be targeted at those who are at the greatest risk, and this is one of the ways we can prevent and help prevent the most severe outcomes from COVID-19 and the Omicron variant of concern. Yesterday, those 63 to 64 who are eligible received their invitations to make an appointment. Next Tuesday, those 61 and 62. Next Thursday, those 60. And that will continue, including for those in clinically vulnerable categories and others. In short, this is an extraordinary effort by healthcare across British Columbia. There will be opportunities to book, and when you receive an invitation, I strongly encourage you to book, because if you're receiving an invitation, right now it is because you're in a category of people, either due to age or other circumstances, where you should get your 3rd dose and get it now, and I encourage everyone to book. We can slow Omicron, and we can preserve our healthcare system in these challenging times. We are taking the steps to do it, and we all need to take those steps. Right now, we must do both, slow Omicron and protect our healthcare system. No matter how we celebrate the holidays, the greatest gift we can give this year is to protect the people we love and care about by slowing the spread of Omicron. Doing that and sharing that message with friends and families we talk to this holiday season will make all the difference in the days ahead. And with that, we're happy to take your questions.
Thank you, Minister. As a reminder.
Thank you, Minister. As a reminder to media on the phone line, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. First question this morning is from Lisa Cordesco, Vancouver Sun.
Thank you. I'd like to get your reaction to the information put out by the BC COVID modeling group. It's predicting a tidal wave of Omicron by the end of the 1st week in January, followed by a hospitalization rate that will exceed BC's capacity. What do you make of those conclusions?
Yeah, I think modeling has been helpful for us from the very beginning, but I go back to what I've said from the very beginning. Models are dependent on the inputs that go into them, and there's still much that we don't yet know about Omicron in particular, about how it's spreading, and about severity of illness. So by necessity, all models are wrong. Some of them are really useful, and this modeling group has been part of our team. We have others that we look at as well, and being able to look at all of the different models gives us a sense of what potentially could happen. But I think what we need to focus on is that we can do things to control this. It's not a prediction of what's going to happen in the future. What it is a set of parameters that could happen. And what we are seeing is the actions that we take can make a difference in what the outcome is going to be. So we still do not yet know about severity of illness in our context here in BC. But we do know that the things that we can do right now can slow this down and can help prevent that impact on our healthcare system. And that's what we're asking people to do right now.
Lisa, do you have a follow-up?
Yeah, I wanted to ask about the vaccination and the booster program. Why have you not used medical students or even trained people to set needles instead of, redeploying healthcare workers from hospitals to do it?
We actually have. You'll remember some months ago, well, actually a year ago, I actually signed an order, and it's up there on our website, that shows all the different groups of people. So we have medical students, nursing students, physio and OT students, all health professional students who have been trained specifically on vaccinations, who are working in our clinics. We have paramedics, firefighters, pharmacists, pharmacy technicians. We have expanded it dramatically to a whole class. Dentists, chiropractors. We have many people, including retired and recently retired nurses and physicians and other healthcare providers. So we have expanded that dramatically some time ago, and we're pulling people back in to support the latest booster efforts too.
Next question is from Christopher Folds, Kamloops This Week.
Good morning. You touched on the gym closures. And part of the health order recently was the gyms are closed and sports tournaments are canceled. The provincial curling championships in Kamloops were initially canceled, but I understand there's been an exception made for them, and they will go ahead under certain protocols. We have a group of business gym owners in Kamloops who remain open, and they cite, as you mentioned, the need for the mental health help the gyms offer, and they are staying open. Is there anything that can be done like you did with the sports tournaments to allow gyms to stay open through this period?
So gyms must close during this period. There are things that we can do, and my gym does it very, very well, to connect people to be able to support us having that physical activity remotely right now. What we are seeing is that this is passing so quickly in those indoor environments, even when we have lots of space and when we've been doing everything right. And I want to say that I've met with some of the representatives from the fitness and gym industry yesterday, and they have been leading in making sure that we can do things as safely as possible. Right now, we're in a place of real uncertainty with a lot of transmission in younger people in the demographic that really is connected to their gyms. So they must right now stop that. In terms of the one bonds bill that I understand we're looking at, it really is about trying to have the higher level competitive sports being able to do things in a certain way. So there's no spectators. There's a whole variety of things that are involved in that. And I will say that the ultimate decision has not yet been made on whether that will continue or will go ahead. It much depends on what happens in the next week.
Do you have a follow-up, Christopher?
Yes, thank you. Part of the gym owners, sort of, I guess, their frustration, and I've heard it from other people, is what seems to be, to the layman like myself and others, the kind of inconsistency in the orders. The Real Theater is a prime example. They could not operate as a movie theater, but they could as a sports pub. The vaccine card mandate, the customers must be vaccinated, the employees don't have to be. And then on that gym note, the YMCA here in Kamloops says their gym area is closed, obviously, but the sauna, the hot tub, and the much smaller enclosed pool area remains open. So is there room for a better explanation for the rationale behind this for the layman?
Yeah, so you're talking about several different things that have different impacts. And yes, it's very much trying to find the balance of the highest risk activities. And yes, movie theaters were at a higher risk, and we have now tried to address those. So we know that seated events, when you're not exerting. And right now, one of the reasons why I've been focusing on those areas that are indoor where we're exerting, so gyms being a classic example, is that we are seeing a lot of transmission now through the very small droplets and aerosols. And the measures that we had in place that were working for Delta, for the other variants that we've seen, are just not enough at the moment. It's spreading very rapidly, even amongst people, and because of that shorter incubation period, it's before people can notify that next generation of spread. In terms of the BC vaccine card program, and I've said this many times, it's my responsibility to put in place the public health measures for people who are attending those places. It does not mean in any sense that workers in those places don't have to be vaccinated. It is their workplace that makes sure that employees may live up to the standard that's needed in that workplace. And if there's transmission in those workplaces, they will be shut down. So we have different measures in place for workers. And, of course, people who work in the hospitality industry, for example, cannot go to stay in the restaurant or go to visit a movie theater or other place unless they're vaccinated. And I know that across the board, most of the restaurants, for example, staff are vaccinated because they recognize the importance of protecting themselves and their workplace.
Next question is from David Mulkel, CTV.
Dr. Henry, David Mulco at CTV. I want to talk a little bit about testing and testing strategy. I appreciate the clear clarification around that. Folks who have been in these lineups this week, as you can imagine, have called it organized chaos. Perhaps that is being generous. But my question for you is, how is it that we're in this situation, given we had at least a couple of weeks of lead time to prepare, and what are we doing now to ramp up our testing capacity for the weeks to come?
Yeah, I think our testing strategy has always been to use the PCR testing for those who need it, where it changes your clinical management, or for people who need to have an accurate negative test so they can work, like healthcare workers, for example. And yes, you can say that we have been planning. The maximum that we actually, capacity that we have in terms of machines, in terms of people in this province is about 20,000 PCR tests a day. That's our maximum. That is how we have planned. You can't create people to work in a lab out of nowhere. And that is part of why we need people to focus on, and we've been saying this from the very beginning, testing is for people who have symptoms. And we need to really focus on that. And part of our rapid testing strategy has been to supplement that. And now we're using that particularly in our testing centers for people who are at lower risk of having more severe illness. And so our rapid testing is able to support people who have symptoms and being able to determine who's got COVID and not. So it is a challenge, but you know, the challenges we're facing across the country and around the world. This is spreading very rapidly, very quickly. And we ramped up to the maximum capacity that we have here right now in this province.
Follow up, David?
Yeah, one of the things I also want to ask you about, I think I'll leave gyms alone because that's come up a few times and you've answered that pretty clearly. But just talking a little bit about the inconsistency in terms of closures and capacity controls. I personally have been in sort of different retail shops, malls, spots where there are no capacity controls, where there is no distancing, where people are sort of on top of each other. And I don't want to be a Grinch because it's Christmas Eve, but help people understand, you know, okay, gyms are closed because people are exerting, but why not bring in capacity controls for malls, for retail shops? Bring it down to 50% or 25% if that is a risk as well. And we're seeing people gather in those locations as well. Boxing Day coming up and so on. Your thoughts?
And you'll know that we put in orders around what's happening on Boxing Day and other sales, and we've been working with the retail associations. It's a qualitatively different situation, and this is really important. This is where, you know, we have put in the mask mandate in all of those settings, and I know many, many retail settings are doing a very good job at capacity limits, and we know people were pushing that. We've become a little bit complacent as we are making our way through what was our last wave in Delta. We need to step that up again now. And that means all of us doing our bit thinking differently again, going back to recognizing that Omicron is different. It is spreading faster, it's spreading much more quickly, so we need to go back to giving people space. We need for retailers to limit people, limit those capacities, give people the distance and the space. But we also know that those transactional settings where you're moving past somebody, where you may be standing a few feet away, everybody with your mask on, with the increasing ventilation or the larger spaces, you know, those are less risky environments. It really is the workers in those environments who are most at risk, and that's why, again, once again, we need to go back to using our COVID sense, as the Minister would say. So yes, everybody now, make sure you wear your mask. If you're somebody who cannot wear a mask, then you can take curbside pickup, do online. There are other ways that you can get what you need without going into those indoor environments. And everybody, I'm appealing to you again now. We need to take a step back and recognize we're dealing with something that is different, that is moving through all of us. So be respectful, wear your mask, keep your distance, and be patient with each other. It's going to be a challenging few weeks until we actually understand how this virus is going, this strain of the virus, how Omicron is going to move through our communities, and we need to do that together.
Keith Baldry, Global News.
Oh, hi there. Thanks for taking my question. Regarding the concerns of people going to get tested when you don't need to be tested and basically using up these PCR tests, are any changes being made to procedures at the testing stations in terms of who can get tested? I had a caller on the radio this week tell me that he was in line for 3 hours in Coquitlam and suddenly was taken out of line. He was 40 years old, and he was told that only people over age 65 as of that moment were going to get PCR tests, that everyone else was going to get rapid tests. So again, just given the concerns, are procedures changing at the testing stations?
Absolutely, and they have, as we have understood more about transmission and risk. So yes, there is triage happening at the testing stations, particularly in Vancouver and the Fraser Health regions where we've had long lineups, and here on the island. So we are using the rapid antigen test to supplement PCR testing, and PCR testing will, depending on the situation, people will be triaged, and if you are younger and don't have underlying risk factors, and particularly if you're vaccinated, then rapid testing may be the most efficient way for you to get what you need. And for people who may have underlying risk factors for more severe illness, and that usually is people who are older or younger, especially younger children, then you will be prioritized for getting the PCR tests.
Do you have a follow-up, Keith?
Yes, more about the psychology of what's going on right now. With so many people double dosed, is it harder to get through to those people with to express the urgency of the situation? Many people probably think they're bulletproof right now with double doses, and obviously they're not. What can be done to get through to them?
You know, I just think, and we've been trying to say this as we've learned more in this last week, that the game has changed with Omicron. We're in a different pandemic again. And there's some positive things about it. I think the fact that we have so many people who have got their vaccines means that hopefully we are going to get through this without having a lot of severe illness. And so far we're seeing that. It's a little bit hard to tell because it's mostly younger people and younger people who have stepped up and got their vaccines. So that is the really positive thing we're seeing about this. But we need to change our behaviors, and we can control how this virus is going to affect us by doing those things that we know worked way back then in March of 2020 before we had vaccines. So on top of vaccines, we now have other measures that can help too. So we need to go back to those other measures, and we need to really recognize that this is spreading really quickly, mostly causing mild illness in younger people who are vaccinated, and that's great. But we do need to change our thinking. It's not, you know, the things that we were concerned about that we could do with Delta are not necessarily working anymore. So we have to be that much more careful right now. And I talk about, you know, we're learning that it's binding more to the upper airways, which means we can get a lot of virus that can spread very quickly, very easily, and especially in indoor environments, in very small droplets in the aerosols. So it is thinking differently to get us through this period of time. And the one big question that we don't have yet, fully understand yet, is how severe this is going to get. What's the impact going to be on our hospitals? So the timing is the worst. I know that. I think we're all feeling that. But this is going to be a Christmas where we have control. We can do things, and part of that means sacrificing again and supporting each other to stay away if we're feeling sick at all. And we will get through this by doing that. And I'm sure the Minister will have some comments on this too.
Go ahead, Minister Dix.
Clearly, as described today, and as we've been seeing in the numbers here and everywhere else in the last week, 9,500 cases announced in Ontario today have changed significantly. In Vancouver Coastal Health and in Fraser Health, we had an average test positivity of about 2% in the period leading into Omicron, and that obviously people were adjusting to those circumstances at that time. We've now seen those levels go up 8-9 times in the course of a week and a half, and that requires us to change our behavior. I want to note that, for example, yesterday the 2,000 tests were based on 20,133, so expansive testing and a high test positivity as a result of that. Essentially 20,000 tests and 2,000 test positives is across the province, a 10% test positivity, which is an increase across the province of about 3 times of what it had been a couple of weeks before. So we do have to adjust and change as a result of this, and it is difficult to adjust and change because we've had to adapt a number of times, but I believe that people are absolutely prepared to do that to keep themselves safe and healthier, and to keep the ones they love in their communities safer and healthier, and to protect the healthcare system, and we need people to do that right now. You're going to see, and I didn't mention this earlier, but we're going to see this afternoon, we're going to be providing that bulletin for everyone, so me on the phone with all of the regular case and hospitalization data and critical care data, and that'll come out about 3 o'clock today, and so you'll see those numbers, including all of the usual numbers and the updating of the dashboard on Monday and Tuesday. Of course, you're going to get the case numbers, and then on Wednesday we'll be back with a full briefing on all of the numbers, so you'll be able to see that. But what I encourage people to do is to see what's happening here and what's happening everywhere, and to change our actions accordingly, and to reduce, in particular, our social interactions. That's what we have to do right now, and I strongly encourage people to do that.
Next question is from Graham Wood, Glacier Media.
Well, hi there, Dr. Henry. Dr. Henry, is COVID, is this Omicron variant airborne? Omicron.
I think, when we look at COVID.
When we look at COVID, all of the SARS-CoV-2, which in various different forms, it's been transmitted through the air. Absolutely. We've said that from the very beginning. But the relative importance of the different size of droplets depends on the infectiousness of the different strains. So it becomes much more important to have protection against those aerosols, those smaller droplets. And really it's a combination of physics. So if a smaller droplet, an aerosol, has less virus in it, but if that virus is more infectious, you can get infected with the smaller droplets. When we initially saw early on, you needed a larger dose of the virus. And so it was much more important to look at protecting yourself from the larger droplets. But it can spread from all of them. And that's what's so important right now. So in terms of the definitions that we use in the healthcare setting for airborne transmission, it really talks about viruses that can be suspended in the air and travel long distances, and we're not seeing that behavior, the behavior that we see with measles or chickenpox, for example. We're not seeing that behavior and how this virus is transmitted, but what we are seeing is that those aerosols become more important with the higher transmission variants like Omicron. So that's why it's so important right now that ventilation is is much more important. Staying out of those indoor settings where we're having close conversations with people without wearing masks, making sure we have an appropriate mask for the situation that we're in. So if we're going to be indoors with a group of people for a period of time, then upgrading to a medical mask or an N95 if you can handle how the N95 fits, or a medical mask with a good quality cloth mask over it that helps mold it better to your face. So all of these things are wrapped up in how this virus is transmitted. But it becomes much more important with viruses like the strains like Omicron, for sure.
Graham, do you have a follow-up?
Yeah. Are you still comfortable with the Canuck game proceeding on Monday?
Obviously, we're looking at these on a day-to-day basis. We know that the increased space in some of those larger environments, we've now, of course, increased capacity, the importance of mask wearing, continuous mask wearing, which we've not always been adhered to. So we're assessing these on a day-by-day basis.
Next question is from Rob Monroe, Info News.
Thank you, Dr. Henry. I'm just a bit confused about the numbers. We had 2,046 new cases yesterday, but the data said there was 975 Omicron, which is the total we've had so far. So how long is it going to be before the Omicron is the dominant strain, and why are so many people must be getting Delta?
Yeah, so the Omicron numbers are those that are confirmed by whole genome sequencing, and so there's a delay. So we are seeing that the percentage of cases on a day-by-day basis that are Omicron compared to Delta is rapidly rising, and it's over 50% now. We expect it to be the dominant strain this week. So that's what we're seeing. So people who get a positive PCR test, they're notified right away. That's what we report on a daily basis. So the 2,000 people were people whose tests were reported yesterday. It takes a delay of several days to get the whole genome sequencing. So what we get is a trajectory of what we're expecting. So most of the cases, the 2,000 cases from yesterday, will be Omicron.
Follow-up, Rob?
Yes, we're trying to get some clarification on the rules for in-home visiting, and you said 10 individuals or one household if it's larger, but could we therefore have 10 people from 10 different households come and visit us tomorrow for Christmas dinner?
You could, but that is not our recommendation. We want people to keep it small. But there are some groups of people who are close connections. They may be sisters and brothers in a family who come from different households. But so a maximum is 10. That is reducing your risk. But you know what? Right now, people need to think, if I have any symptoms at all, even if I think it's just the sniffles or a cold, that I don't want to be around my new nephew or niece, or don't want to be around my grandparents, or people who might have more severe illness if they get sick with this. If you have any symptoms, stay away from the gatherings right now. Keep those groups small. If there's anybody who has immune compromising conditions, people going through cancer treatment, find ways to connect with your family and your close friends in ways that aren't going to put you at risk. This virus is spreading very rapidly. The 2,000 positive cases yesterday are just the ones that we tested. We know that there are many more people that didn't go for a test. There are many more people who are just doing the right things and staying at home. So we all need to rethink how we spend the next few days. And if you have any concerns at all, put it off. Find a way to connect, as I will be doing with my family who don't live in this province. Find ways to connect that are meaningful and that will get you through this period of time. And I know that means for some people, disappointingly, you're going to have to reassess your plans. Do the home delivery of turkey and meals. We've seen a lot of that. That's how we get through this together.
We have time for one more question this morning. John Hernandez, CBC.
Good morning. Could we get answers for both in English and French for these? But first, Minister Dix, what advice do you have for employers in non-essential sectors who currently require proof of a negative COVID test for employees with any cold or flu-like symptoms to return to work if not everyone can get access to testing? Also, earlier in the pandemic, people who tested positive were prioritized to be notified. Those who were waiting longer to hear were negative. Is that happening now?
Go ahead. Sure. Just to say that.
Sure. Just to say that all the testing now is automatic for most people. There's some people that get a call, but most people get a text or a message. So that's whether you're negative or positive. So the testing notification is going out right away to people. So that has changed from very early on in this. In terms of employers, right now there is programs in certain businesses, particularly some of the essential businesses, where there's sequential testing, and that obviously can continue, and we need to make sure that for those people who have symptoms that they can get the accurate tests, and I talked about emergency services, healthcare workers and others. For those settings where right now they're not essential services or there's a pause over this period of time, then the best advice right now is if you don't need to go into work, if you can work from home, you can do that from home, then that is the recommendation right now.
Go ahead, Minister Dix.
C'est que les notifications sont plutôt automatiques, donc pour des gens, on reçoit des renseignements assez vite après test positif. C'est déroulé depuis beaucoup de mois, depuis vraiment le commencement de l'année. Donc, on voit cela un peu partout. Mais notre recommandation, bien entendu, c'est que si on n'est pas essentiel et on peut travailler à distance, c'est important de le faire, surtout maintenant. Donc, je pense que ce que la Dr. Henry vient de dire, c'est important pour tout le monde. Bien entendu, on va avoir beaucoup de discussions ici, le recommencement pour un grand nombre de gens le 3 janvier ou le 4 janvier. Mais pour l'instant, il faut être prudent dans tous les éléments, que ce soit dans notre contexte personnel ou au travail.
John, do you have a follow-up?
Yeah. Can you clarify the test positivity rate in Vancouver, Coastal, and Fraser Health? Minister Dix mentioned 10% across BC, but how high is it in the urban, densely populated areas? And also, can you expand a bit on what you said about people who have already had COVID getting reinfected with Omicron? How often is that happening in BC? And again, both in English and French.
Yeah, I can start with the.
Start with the. Sorry, I've forgotten already what the first question was. The test positivity in Vancouver, Coastal, and Fraser, it's still just under about 10% from yesterday's numbers, but it has increased, and as the Minister said, it increased from around 2%, which it had been at for quite some time in those areas. So yes, 10% in the large urban areas with large numbers of people is very high numbers of people, and that's only the people who were tested. So that's one of the reasons why we're putting out this message today about if you have any symptoms at all, reassess your plans right now. Don't go to gatherings. Stay home. Take care of yourself. Sorry.
Positivity is it's 10%. We're moving to 10% as a 7-day rolling average in the Metro Vancouver Health Authority. So when you see a climb in cases and test positivity, and you're doing a 7-day rolling average, you're dropping off the first day and you're adding the next day, and obviously the trajectory is significantly upward. So we had yesterday, and I'll get you the exact numbers, but it was 1,621 cases. Or health authorities. So that's a test positivity, a 1-day test positivity well over 10%, and a 7-day rolling average that's approached 10%. And so that's significant. And if you look at across the province, because Vancouver Coastal Health right now has moved to having the highest test positivity that in the last number of days. You'll see that reflected slightly differently, but it's going up everywhere. I should say that people in the north and our healthcare workers in the north have been dealing with 15 to 20% test positivity for months, and doing an exceptional work under those circumstances. But we saw the effect of that with the less transmissive Delta variant, although the Delta variant has had a very severe effect, especially on unvaccinated people, and indeed continues to. So those are the rates, and I'd be happy to give you the precise numbers on a daily basis, but also the 7-day rolling average by health authorities, which is obviously going to go up again today because it's significantly higher yesterday than it was 7 days ago. Je dirais en français qu'on a eu à peu près 1600 cas dans les deux régions de santé dans la région de Vancouver hier, c'est-à-dire une test positivité en moyenne pendant 7 jours de 10%, plus ou moins, mais beaucoup plus hier. Bien entendu. Donc, on a eu 20 000 tests hier et il y avait 2000 cas, donc ça fait 10% un peu partout dans la province pour un jour. Donc ce qu'on voit, c'est que la capacité de transmettre de ce variant Omicron est exceptionnelle et on le voit un peu partout dans la province. Donc, il faut prendre des mesures personnelles. Nous sommes en train de prendre des mesures dans le système de santé pour nous protéger et pour anticiper ce qui va se dérouler dans nos hôpitaux dans le mois de janvier. Donc, il faut agir maintenant pour protéger les gens en janvier. Et je souhaite que tout le monde suive les conseils de la Dr. Henry et de la santé publique en ce moment. C'est absolument essentiel et capital pour tout le monde. Thank you very much. Merci beaucoup. Oh, she wants to say something more. Okay, great.
Answer your second part of your question, which is about reinfection.
Answer your second part of your question, which is about reinfection rates. So this is people who have been infected before, and what we do not yet have those data from British Columbia. It is one of the things that we look at from our linked data that we have. And that we are looking at that, but as you know, our rapid increase is really relatively recent here. Where this information comes from is from data, as I've talked about. You know, we have this puzzle. We're putting these pieces of the puzzle together. So there's some really good data from South Africa that shows that even though they had a very high rate of recent previous infection, the reinfection rate was 10 times higher with Omicron than what they saw with Delta, with the Delta wave that went through there, and Beta prior to that. And the other piece of information that came out just yesterday was from Scotland, and part of the study that they did looking at severity of illness and potential hospitalizations and risk of hospitalizations with Omicron compared to Delta. They also were able to look at reinfections in the database that they had there in the UK, well, in Scotland, and particularly they've had this surge that's been going on a little bit longer than us, so they have greater numbers of people. And again, it showed that, and I won't have the exact numbers off the top of my head, but it was less than 1% reinfection with Delta, and up to, it was 10 times higher, so I believe it was 7.6% was what comes to mind, somewhere around that reinfection rate with Omicron. So even in the early numbers that they're seeing, it's a much higher reinfection rate in people who were infected before and not vaccinated with Omicron. So that is just a warning sign to us, and really what it tells us is that this virus is spreading in a slightly different way. It's causing infection. It's causing infection faster and more severely in people who are not vaccinated. And so if I can put a plea out, your risk is going up right now because the virus is spreading even in people who are vaccinated, although at a lower rate. But still, because there is more virus circulating, people who are not vaccinated are at greater risk right now. So please walk into a vaccine clinic, get that vaccine, get that your first shot, that's going to start getting your immune system working on getting specific protection from this virus, and you will need that. So that is an important message to everybody right now, and I hope you all have a very safe and happy Christmas.
That's all the time we have. Thank you for joining us.